Continue. Hello, everyone. My name is Jack Crompton. I'm the mayor of Whistler, and today I am privileged and pleased to be joined by Dr. Karin Kausky and Dr. Olivia Bayley. And we want to talk to you a little bit about what's happening in our community right now. Thank you to both of you for joining me. I enjoyed our previous conversation, and I think that this will be useful as we try to understand what we're dealing with. So thanks for joining us. All right. Good. I will start with a question that has been on my mind a lot, which is are we dealing with an outbreak right now? So Dr. Kausky, is this an outbreak that we're facing in town right now?
It's a good question, and a lot of people have that question. It's not. We don't meet the technical definition for public health for an outbreak for a lot of different reasons, and one is just the morbidity that it causes, and we have a very young population, but we do have a really compelling number of COVID positive cases daily, and a lot of people that are unwell and a lot of contacts. So although we don't meet the technical definition of an outbreak, we do really have a really high compelling number of cases that is affecting our healthcare system and our community.
Mm-hmm. So Dr. Bayley, what are you seeing as far as the people that are coming in for care in our community right now?
I'd say a vast majority of people that are coming for an assessment are still younger people, although we're seeing people across the full age range, but majority younger people, and mostly with pretty mild symptoms. So it's still mostly those people who, if it wasn't for COVID, might push on and still go to work with their symptoms, or maybe take a day off, might still go skiing. So, it's mostly people who have quite mild symptoms, not really alarming in and of themselves. We have seen a few slightly more serious cases as well, where people are affected more significantly.
And so if the majority of those cases are less serious, why is it such a concern for us as a community?
I think it's concerning on many levels. Obviously, those people are contagious. They may well be passing it on to their friends. They may have already passed it on to some of their friends, family members, housemates, workmates, colleagues. But it's also at a level where we're seeing people getting it in the community. They don't know where they've got it from. So it's obviously out there at a significant level. I think the other real concern for us as doctors is thinking about our vulnerable patients, our elderly patients, people who are immune suppressed on chemotherapy. Those are the people that we really are worried about. Lots of younger people in Whistler probably don't know many elderly or vulnerable people, but they are there. And that's another level of concern, obviously, trying to protect those people.
So Dr. Kausky, what kind of advice would you be giving to people that are living in shared housing in Whistler right now?
That's a really good question, Jack, because that's one of the other unseen issues with this, is that there's a lot of people for whom this creates a really difficult situation. It's difficult to self-isolate in a large shared household. It can be economically difficult if your self-isolation continues to extend on week after week after week. And I think these people are really trying to do the right thing. Really important to know that we have Whistler Community Services that has a lot of services available to support people in this situation. They have food bank deliveries, they have hygiene pack deliveries, they have rent relief. They actually also, we now have self-isolation units for people that find it impossible to self-isolate in their current living situation. We do have housing available for them to self-isolate.
You and I have been talking a lot over the last week about the structural challenges that we face, and that this is not, by and large, an example of a bunch of irresponsible people that are acting out, but it's a structural challenge. Tell us about that.
Well, again, I think it's not unique to Whistler that in most parts of the world, COVID disproportionately affects a demographic that is economically vulnerable, that lives in dense, large housing, and that works in frontline service type industries where they're exposed to a greater extent. And I think that combination just makes their likelihood of contracting COVID much higher. And then once they have, it's much harder to manage.
Mm-hmm. Dr. Bayley, what do you tell someone who has tested positive to do as they leave the clinic?
So when they're leaving the clinic, we're obviously doing the test and they don't yet know how they're going to test. Okay. So the advice that we're giving them is generally that if they've been in contact with a positive case, that's close contact, they will need to be in isolation for 2 weeks from that date, regardless of how they test. As you know, COVID, this is not a good rule out test. You can absolutely have COVID and test negative. And we think that happens probably in about 30% of cases of people who have COVID, they'll come back with a negative test. So that person leaving, if they've been in close contact with someone who's tested positive, they're going to be in isolation for 2 weeks, regardless of how they test. In the other situation, it's people who have not been in close contact with a positive case. And so for those people, if they have pretty mild symptoms that could equally be a cold, they just need to wait until their test result comes back, which is only a day or two. If they feel well, if the test is negative and it doesn't turn out that any of their close contacts have tested positive, they can go back to normal at that point. If they really do have typical COVID symptoms, even if they test negative, they should be getting another test and staying in isolation.
And Dr. Kausky, what advice do you want to share with our community, people that aren't feeling ill or haven't been near someone who has COVID as far as they know? What do we need to know as a community?
I think the first thing is I talk to a lot of people every day, and maybe 70% of the time, the conversation starts with someone saying to me, I don't think this is COVID, but here are my symptoms. And clearly over the last 2 weeks, a lot of those people have been wrong. So I think everybody should take any symptoms seriously. If you have any concern, don't try to rationalize it. Give us a call and at least talk to us about it or get a test done. My other piece of advice is that we have really big numbers and we really need to turn this around. This is making life difficult for a lot of people in our community. And unfortunately, the way to do that is not very exciting. And it's to just continue to follow the public health directives around physical distancing, mask wearing, hand hygiene, not having a very big bubble, as a matter of fact, very small, and actually doubling down on those things that I think most people are incredibly weary of right now. But that is the only way out of this.
Yeah, I feel like that is one of the most challenging things about COVID now, is that the solution is something we've heard for 10 months and we're tired, we're weary of it, we're bored by it. We want some silver bullet that will fix this. And we've had the best advice from the beginning, and it's employing it and putting it into practice again. And a piece that's really resonated for me, as you and I have talked this week, is that those people that are exposed based on the way our communities and communities around the world are set up are the ones that need to do the hard work. And it's a big ask. And we're so deeply grateful for how you keep our community running and operating, and you do such important work when COVID isn't here. And now you're being asked to do the tough work now. And we just don't want to miss how big the ask is and how grateful we are for your commitment and love and care for our town. So Thank you for it. And please reach out to us, reach out to these docs if you have a need of help from us, because we want to be there for you in whatever way we can. So Dr. Bayley and then Dr. Kausky, anything that you want to leave the community with today? Dr. Bayley.
I mean, I think it's just to echo, Jack, what you just said. This is really hard on everybody. You know, it goes against our nature as human beings. You know, we're hardwired to want to be close to each other, to want to make physical contact, to, you know, you want your kids to play with other kids. Like, it goes all against our nature, and it's a really hard thing. And, you know, I admire everybody who's towing the line and doing what they got to do. Especially some of these youngsters in big houses, they're in back-to-back quarantines week on week on week. I mean, it's really not easy, but yeah, we'll get through.
Mm-hmm. Dr. Kausky.
I mean, I think I would largely echo what Olivia has said. I am just so grateful and want to say thank you to all the people that are doing the right thing. It doesn't go unnoticed. It seems like it does, because there's a lot of attention paid to the people that aren't doing the right thing. But I am just so grateful to live in a community where the vast majority of people really are doing the right thing at their own expense for the greater good of our community. And that just makes me really proud to be a part of this community.
Thank you both. I want to finish with the boring message, which is wash your hands, keep physical distance, stay home if you're sick. Go to the doctor if you need help. They are there for your help, and reach out. If you don't know the answer to a question, reach out. We want to be there for you. Thank you for your love and your care for our community. And I want to finish with, be kind, be calm, be safe. Have a wonderful weekend. Enjoy, stay connected to the people that you love in whatever way you can, just not physically. Thanks for your time today. Take care of yourself. Take care of each other.